Sure. So I'll start. Cynthia Mahoney. I'm in Danville, California, retired nephrologist. And then I'll just call the next person I see.
Yeah.
Krista.
Hi, I'm Krista Huerta. I'm one of the ER doctors at Kaiser Richmond.
And then just call the next person you see, Krista.
Mary?
Sure. Hi, all. I'm Mary. I'm a campaigner with this organization called the Sunrise Project. My practice, I'm a wilderness first responder certified. That's about as far as I get. I will call on Mike.
San Francisco. I'm an internal medicine on the University of California, San Francisco faculty in epidemiology and biostatistics.
Great. Thanks for joining.
And call on someone. All right. How about Meg?
Hi, I'm Meg Whitman. I'm an internist. I'm calling from Davis, California, and I'll call on the other Megan.
Hi, I'm Megan Shumway. I'm a retired public health and obstetric nurse from Sacramento, California.
Cool.
Great.
Oh, and let's see, how about Lisa?
Hi, I'm Lisa Hartmeyer. I'm a nurse practitioner working in kidney transplant at the University of California, San Francisco.
Oh, cool.
And I will call on Trisha.
I'm Trish Roth, Santa Monica pediatrician and grandmother, retired, of 11 grandchildren.
Wow, amazing. I have a poem for you. You want to call on somebody else?
Why don't we take Angela?
Hi, I'm Angela. I'm a pre-med student, and I'm calling in from Antioch, California. Patricia?
Patricia, did you hear?
Hi, can you hear me?
Yes.
Hi, I'm Patricia. I'm calling in from Fremont, California. I live in Palo Alto. I work in Fremont, and I'm a psychiatric pharmacist.
Nice. Thanks for joining.
Thanks. Sorry, I was trying to figure out my mute-unmute situation, so I don't know who's been called yet and who hasn't. Carol, has you been called?
Hi, I'm Carol Becker. I'm actually from Florida. It sounds like I'm one of the few there. I'm a pediatric nurse practitioner, semi-retired. I work part-time. And do I need to call on somebody else?
Yes.
That'd be great. Welcome.
Okay, I don't know who's left over.
How about Bob Gould? Haven't heard you yet.
Okay.
Hi there.
Thank you.
I'm Bob Gould. I'm president of San Francisco Bay Physicians for Social Responsibility, also on our national board. And I work at the UCSF program on reproductive health and the environment, also together with Ashley and other colleagues within California Medical Association.
Great. Thanks for joining. Do you want to call on somebody?
David Bezanson.
I'm part of the Environmental Health Committee, PSR. And I worked at UCSF as a clinical psychologist and neuropsychologist. I'm happily retired and involved in many environmental committees.
So that was a little garbled for me. What I captured, David is a clinical psychologist with SF Bay PSR. I think I got that. Who else hasn't said hi yet?
Okay, and it was a little bit late, so I don't know who hasn't been called.
Oh, sure. I can help. Maybe Kim Harvey, I don't think. If you want to say hi.
Yeah, hi, I'm a retired pediatrician. I live in Palo Alto.
Welcome. Great. You might call in somebody else?
I don't know who else to call in.
This is good. It makes us pay attention.
I just joined. My name is Noemi Spinazzi. I'm a pediatrician at Children's Oakland.
Awesome. Thanks for coming.
Cameron Leggett from Santa Rosa. primary care, internal medicine.
Woohoo! Thanks, Cameron. Who else hasn't gotten to introduce themselves yet?
Yeah, I'm Sandra.
Can you guys hear me? Can you guys hear me?
Yes.
Yeah.
Hi, this is Yoshi Lang. I'm a family doctor in Contra Costa Health Services.
Wonderful.
Great. Thanks, Yoshi. And who is other?
Hi, I'm Sandra Rubin, a retired pediatrician in Sebastopol.
Hmm?
Great.
Nice to hear you.
How about
Bill-
Angela?
Angela first.
I think Angela went, but I'm Angelina.
Oh, Angelina.
From last time, yeah. I'm an allergist and I live in Davis and I work in Woodland with the Woodland Clinic. So.
Great.
Woodland's like Marin?
No, Woodland like as in Woodland, California, which is north of Davis, west of Sacramento in Yolo County. Yeah.
Gotcha. Cool. Thank you for joining.
I haven't gone. Hi, I'm Bonnie Hamilton. I'm a pediatrician in Fairfield and was with Kaiser Permanente for 25 years now, do more volunteer work and serve on the board of the Solano County Medical Society, and I'm vice chair of District 10 delegation to CMA. Thank you.
Thanks for joining. Yeah. Heather Whelan, did you say hi?
I came in late. Margie Chen, retired OBGYN in San Francisco.
Yay. I think Bill Pevick and maybe Richard Godfrey haven't shared yet.
I'm Bill Pevick. I'm a retired vascular surgeon from UC Davis in Sacramento.
Anybody else who hasn't said hi yet?
Richard, you need to unmute.
Karina in LA, pediatrics.
Nice. So,
Sorry.
anybody else?
Rich Godfrey, retired surgical oncologist, very involved with climate health in multiple areas, and happy to be part of this.
Awesome.
Great.
Cool. So thank you all so much for carving out your hour to spend with us. My name is Ashley McClure. I'm an internal medicine physician in Oakland, work with TPMG Kaiser, co-founder of this awesome group, Climate Health Now, that you're a part of. And I'm going to share some images because it has been a month. I don't have to say that, but let's see. So here we are. Can everybody see my screen?
Yep.
Good. Hallelujah. President-elect that respects science and couldn't be happier about the first vice president-elect woman. So I know I've spoken to many people who had kind of like a hangover after the election because I think a lot of us put a lot into it. And we did it. I think, you know, every little effort that each of us made narrowly escaped disaster. So thank you all. I'm actually, I don't know if this will work, and I'm actually, in the interest of time, I'm going to skip the video. Is that okay?
Maybe we can play it at the end if we have time. How's that?
Yeah, and I think if somebody could put it in the chat, or we could put it in our notes, but because of our just having an hour, I'm gonna highly recommend it today or this weekend. And I want to really spend a little bit of time celebrating an effort that I'm sure most people on this call were a part of. So we put a lot of energy in a coalition with these up top are the logos of the organizations that were part of a coalition that collaborated to gather over 4,300 signatures from health professionals, including representatives from every single state and Puerto Rico and Guam. And together we gathered these 4,300 signatures, and it was for a letter that was basically calling, alerting our patients to the health risk posed by climate change And most importantly, it was asking for them to help us protect their health by voting or calling on climate leaders in the election. And the reason for doing all the work of gathering all those signatures was to get press about it, which we did. So we had 10 radio recordings on the public news service that were short interviews with physicians. I don't think we had any nurses actually, from 10 different states, many from important swing states. So this is probably why Georgia shifted or is shifting. And these aired, and they gave kind of the message that, you know, the medical community, the health community is identifying that we need to act on climate to protect health. So they're really powerful, and we're working on creating a video compiling all 10 of these really powerful interviews to kind of, you know, magnify again the chorus of medical voices calling for climate action. So we got 10 public news service interviews. We got 10 letters to the editor published about the letter, and then one NPR piece that aired on the Seattle Public Radio, my hometown. So we got a lot of press about it, and it was a huge success in terms of kind of really articulating the message of the need for climate action to protect health. And this is just one image from Pennsylvania, again, a really powerful swing state. So they came with text about the interview and then with the interview audio itself. And I don't feel confident enough about putting the radio recording on Zoom, but we'll share these out and hopefully, like I said, in a video form too. And then a really amazing gift that Cynthia gave the world, you could say, and Climate Health Now and this whole coalition effort was a really generous donation that helped to fund paid for boosted targeted Facebook ads in these critical swing states. So these are the last numbers I had, Cynthia. I don't know if you had others, but these were kind of on Facebook. These were boosted ads that went to like exactly the swing states that we needed to influence the most. Do you want to speak to do we know any more about the clicks and the views?
You know, I didn't get any update on that. It would be fun to ask Bev at the end of the campaign.
So this was like another kind of facet of the Dear Patient letter, and just really, you know, upping our game in social media messaging, which we all know climate is the message, the social message is really what we need to translate the most. So it was a huge effort. So many people put in a lot of time, and something we're really proud of. So that's the past month. And then kind of shifting gears now, you know, Climate Health Now are our key strategic priorities really that we're organized around are decarbonization, you know, decreasing fossil fuel supply side in California, especially through phasing out oil and gas extraction, transitioning to, you know, electrifying our economy. And then divestment is another one of our key strategic priorities, and it's kind of been bubbling below the surface until now. And this is really kind of the debut where what I'm going to do is share about what that campaign means, and particularly ways to leverage your voice as a trusted health professional to demand that the U.S. health insurers divest their investments from fossil fuels, because obviously they're at odds with you know, protecting health, given they're fueling the climate crisis. So the goals for today is to discuss the divestment campaign and then to take action together at the end. And God willing, Mary's going to help us use breakout rooms. This is a first, so we'll see how it goes, because there'll be kind of two different ways that you can take action depending on if you do or don't have Cigna for your health insurance. So, and I think just to kind of articulate the intersectionality of this campaign, I couldn't appreciate this quote more by Hop Hopkins from the Sierra Club. And he says, you can't have climate change without sacrifice zones. We can't have sacrifice zones without disposable people. And we can't have disposable people without racism. And I like to come back to this in most conversations I have because, you know, the kind of social justice uprisings that we have had and need even more of, they're so intimately connected to the climate crisis and the climate movement. Because if we eliminate all the sacrifice zones in the world, we will be solving climate. And we can't solve climate without addressing the racism that is facilitating it. And I really see this being connected to the divestment campaign because, you know, basically fossil fuel investments are fueling those sacrifice zones. So it's all connected, as we all know, but just to re-articulate that clarity. So our campaign, our divestment campaign, is a coalition of organizations. We're up over 60 organizations who have co-signed a letter. And what those organizations have in common is that they're working at the intersection of health and environmental justice. And the health professional kind of contingent is a main part, you could say, of the spokespeople for this campaign and this coalition. And what we are doing is we're calling on U.S. health insurers to divest their investments from fossil fuels because of the egregious conflict of interest. Just like, you know, health insurers investing in tobacco, there's clearly a conflict of interest. It's the same, as we all know, if not much more, for fossil fuel investments. And I think there's other kind of groups who, you know, should and can speak more to the financial benefits of divesting, but really our anchor is in the interest of protecting health. So we launched this campaign mid-October, pre-election, so it kind of got a little bit lost in the, you know, the maelstrom of the election. But we launched it, and by launching it, we shared out a press release about it. And Mary, who will get to speak more later, sent our letter that we came out together around to the kind of chief financial officers or presidents of the top 10 health insurers in the U.S. Who are most invested in fossil fuels. And I'll talk about who that is shortly. So the reason, you know, when we were first talking about this campaign in early COVID, you know, it was a time where a lot of health systems were kind of not sure about their own solvency. So at first we were thinking about kind of targeting health systems themselves. But because of COVID, really, we kind of pivoted towards the insurance companies because they were not in such dire straits from COVID. So combined, the top 10 U.S. health insurers whose kind of investments we have information about, and the most recent information we have is from a few years ago, they hold $24 billion in coal, oil, and gas, and that is our target. So I think this is a really interesting table. So MetLife is the greatest investor in terms of fossil fuels, but so they have $18.8 billion invested in fossil fuels. But there was a few reasons it didn't make as much sense to target them because they're more about, Mary will correct me, is it property or life, not health? Health is not their primary product.
Life is their primary, but then they also do kind of a whole mix of other kinds of insurance as well.
Yeah,
and a little bit of health.
Yeah. So Cigna is the next up in terms of magnitude of investments, and they're unique for a few reasons. They operate in all 50 states, which is important for our tactics and strategy. They're exclusively health, and they're the second greatest in terms of you know, the absolute investment. So that's why they are our poster child for the divestment campaign. So while all of these, my personal Kaiser here, all of these companies have received the letter from Mary or mid last month, which has been co-signed by over 60 coalition partners. So they've all been kind of alerted to this campaign, but Cigna is who we're going to target all of our efforts to, with the hope that they can kind of, our efforts on them can influence the others, and perhaps we will shift, after our first success, we'll shift to Aetna or Kaiser, perhaps. But for now, we're targeting Cigna. So I already talked about that. So the divestment movement is quickly growing, and in a shocking way, health systems and medical kind of institutions. Yes. Okay. Health systems are really lagging. So the kind of who is leading divestment actually tends to be faith-based institutions and educational institutions. But despite what you would expect with health, kind of the health sector being committed to protecting health, we are not leading in the divestment movement like we should. So we're helping to remedy that. And at this point, or a few months ago at least, something on the order of $14 trillion so far worldwide have committed to divest or have divested. And what we're trying to do is kind of bring the medical community and the health community into that movement to save everything we love. So we're in good company, and there is leadership within the medical community, but we're adding to it. So the BMJ early this year, they announced their Investing in Humanity campaign, divestment campaign, which is a global sign-on basically. And it's very well written. If you just Google Investing in Humanity, there's an editorial that launched their campaign, which I think is really well written with a typical British wit. So worth reading. And then a couple of years ago, thanks to Todd Sack, who is also a Climate Health Now member, he helped to draft the resolution through the AMA, in which the AMA committed to divesting. The action has not followed as quickly as you would hope on that, but it's policy now. And then many on this call probably were part of the UC efforts to divest. And so the Academic Senate agreed to divest just this year, I believe. So there is movement building, and we're trying to join that club of momentum. And last night I was reflecting on how Mary and I met, and this is really fun. So this article from the Proceedings of the National Academy of Sciences, I don't know how I came across it, but the title says a lot. So it's a research article published in the National Academy of Sciences this February or so, and the title is Social Tipping Dynamics for Stabilizing Earth's Climate by 2050. So it's kind of meta, And I emailed this author, and I was like, I love this. This system thinking is so cool. And I don't even know what I said to her. But somehow she introduced me to Mary, which is funny because I think she's in Germany. And she's like, you should talk to Mary, who also lives in the Bay Area. And what I thought was so cool about this article is that they talk about these 6 tipping points, because we need nonlinear social change, right, to address climate. And so they looked at kind of the evidence for the capacity of these tipping point interventions to induce the kind of decarbonization and change that we need to stabilize Earth's climate. So the urgency of the situation, of course, led me to focus on the most rapid intervention, which is divestment. And just to name, the other thing they talked about is greenhouse gas information disclosure, which all of these are really interesting. Decentralized energy generation, removing fossil fuel subsidies, which hopefully President-elect Biden actually holds up his campaign promise on that. Carbon neutral cities, which many people on the call are working on. Climate education, which is very slow. And then kind of the moral implication being the slowest on the order of 30 years, and we kind of don't have time for that. So, but this is a really cool study, and this is something that I go back to a lot in terms of what to do. And I think, these interventions are really kind of how I think about a lot of our work at Climate Health Now and personally. So this is how I met Mary, is through this paper. And Mary, do you want to give a little background on yourself?
Sure, thanks. Hi, everyone. Really nice to join you here today. My name is Mary Sweeters. I am a campaigner with the Sunrise Project, which is an organization. Some folks might be familiar with the Sunrise Movement. We're actually a totally unaffiliated organization based in Australia, but I'm part of our international team that is focused on global finance as sort of a key intervention point to solve the climate crisis, and essentially trying to accelerate capital out of the fossil fuel economy and into solutions to climate change. And my focus for the last 2 years, since I started with the Sunrise Project, has been on the insurance industry. Most of that focus up until now has been on what are called property and casualty insurers, because many of them are actually responsible for providing the insurance coverage to build a new coal plant or a pipeline, for example. But the entire insurance industry, as was illustrated here, also invests very heavily in fossil fuels. And so I think that we thought that there was sort of an interesting avenue to pursue here, where kind of the narrative, sort of the moral case around health insurers, highlighting that, I think will help to further toxify the investments the insurance industry has in fossil fuels. So yeah, really excited to chat with you all about this today.
Yeah. Yeah, this has been a very cool, interdisciplinary collaboration that's just beginning, really. So this is a incomplete image of kind of some of the partners in the campaign. Many more have joined since I first put these logos up. But suffice to say, we have a broad coalition, and PSR has joined this, 350.org has joined this, so there's many others. But what our campaign goals are is that one of those top 10 health insurers in the U.S. Commits to divesting by next February. Ambitious. We're not afraid to be ambitious. And that 3 of those top 10 health insurers commit to divesting by mid next year. So that's our North Star. And this is definitely worth checking out. So this is a campaign website. I just took a snapshot of it. It's on the Insure Our Future website. And this is where you can see things like the brief that Insure Our Future did along with PSR National, and many other groups have endorsed that so far. It's definitely worth reading. So you can see that brief there, along with the actual letter that was sent to the top 10 health insurer executives, along with the 60 groups who have co-signed it. So that's our campaign website. And more specifically, our demands that we articulated in that letter is that they divest all assets from coal, oil, and gas companies that are not aligned with a 1.5 degree or basically a Paris decarbonization pathway, and also that they bring stewardship activities, trade association, and public positions in alignment with basically the Paris climate agreements, and then that they reinvest in climate solutions to safeguard public health, which is, ostensibly their goal is the public health. So those are the demands that we're asking for. And at the bottom of our letter to them, we asked for a meeting to discuss. And so we haven't gotten a response yet, but part of what we're going to do shortly is kind of work on making noise to get a response. So I'm a very visual and low-tech person. So this is a drawing that I made last night. And I really like the kind of framework for thinking about campaigns like this from 350, from their skill ups about strategy. So this upside down triangle represents the business as usual for Cigna and other health insurers being invested in fossil fuels. And, it's this business as usual is being held up by what they call the pillars of support. And so the way that we've been thinking about it so far in our coalition kind of calls is that the key things that are holding up business as usual, number one is policyholder support. So that could be institutional policyholders, like perhaps I think the UC system. I know Kaiser has Cigna as a secondary insurance for additional stuff. And then individuals who have policyholders. So that might be some of us on the call. Shareholder acceptance. So, you know, the shareholders of Cigna stocks, kind of their acceptance of the business practices is one of the things holding up the, you know, business as usual investment practices of Cigna with their $2.2 billion in fossil fuels. And then public perception and kind of the public reputation of the company, you know, that they're a good steward and a good corporate citizen. Those are kind of the things we've been thinking about holding up the status quo. So our campaign is basically taking a sledgehammer to each of these in a very strategic way to knock down the pillars of support so that they are forced to change. And so we're, you know, the campaign will kind of unfold around each of these pillars, but the one that we're going to focus on today are these two on the left with, this one, the policyholder support, and then the public perception. So at this point, this would be fun. If you could, I think it'd be kind of interesting. Can people in the chat share if you have Cigna as your health insurance? Can you say like yes or something in the chat? Because that's going to be a really helpful kind of group to know about. And what we're going to do, Mary's going to help, is we're going to break out into if you have Cigna as a health insurance for yourself, if you're going to join the breakout room that Mary's going to invite you into, and that room or that group is going to use a use a template letter that we've drafted for you. You can customize it however you want. And then we'd like you as policyholders to send that to whoever Mary identified as the right target inside Cigna to say, hey, I heard you guys got this letter calling on you to divest your investments. As a policyholder, I'm very interested in your response to that. What's your response? And then either tomorrow or next week, we'd like you to follow up with a phone call to just kind of start making noise and have them realize that there's a lot of visibility and health and environmental justice advocates looking at them for their reputation. So I guess right now, if you have Cigna as your health insurer, or one of your health insurers at least, Mary's going to invite you into a break room. Right, Mary?
Yeah. So if the technology cooperates,
Okay.
one thing that's missing is that, oh yeah, and that's a good flag there from Bonnie about contacting Kaiser. So it looks like the breakout room option is not down below in the menu, even though it should be. I might, if it's all right, I might just see if I can stop the recording for a minute, because that might be the thing that's preventing the breakout rooms from happening.
I see it. So I can.
Oh, you do?
I can create. Should I do it manually?
Excuse me.
You might want to make Mary a host or a co-host.
I
have done that already.
We can't see it. So the
only the host can control the breakout rooms.
Okay.
So I could do it manually.
Overlord. Yeah, if you could do it manually, so you can just select myself and.
If people put down is if they can unname and rename themselves in the participants rename themselves and put down Cigna as part of their name, you can figure out who to pick out and put in your breakout room.
It's a great idea.
What if one does not have Cigna, but their partner does or their family member does? Like my parents have Cigna and my fiance has Cigna. I just don't. Should I still be on a group that harasses Cigna?
Yes,
and I mean harass in the greatest of ways. Okay.
Yeah, I think that seems close enough and like a useful thing to take advantage of. So just in case somebody doesn't know how to rename yourself, let me show you that if I can figure it out. Let me see. So the way to rename yourself so that you could put Cigna in your name so that Mary knows to bring you into the breakout room is you go to More and you click on the little side arrow and then you just push Rename. And so you could put Cigna in there. So, and then last question, technologically, Mary, how do I bring everybody back in like 5 minutes?
You go back to the breakout room option, and I think it's like you can just click like end or bringing folks back. Yeah.
Okay. So I'm going to create the rooms now, and we're going to manually do this. Yeah.
Yeah. So you'll select those of us who are going to be talking about the letter, and then other folks are all going to be staying with you, right, for separate conversation.
Okay. So how about I can just do this now. Thank you everybody for your patience, by the way. So Mary, I'm going to put, so breakout room 2 is for Cigna policyholders. So just shout out your name right now if you're a Cigna policyholder.
Well, hang on, maybe I can read you who has put it in the chat. So do me last, that way I don't disappear, which is Noemi,
Bonnie,
and Krista.
If somebody could mute their speaker, that would.
And
Can
Sandra.
we ask everyone to mute, please, or shall I just?
Now we have silence.
Sorry, I was muted. Okay, hold on. Add. Okay, who else should I put in to the Cigna?
So it's Bonnie, Sandra, myself, Noemi.
Sandra.
Is that right?
Sandra.
Did I miss anybody else?
Okay.
Yeah.
So good? Okay. So there we go. I think it worked. Okay. So if you're with me, I believe that you don't have Cigna as a policyholder. So our opportunity that I'm going to invite you to partake in is we have drafted a template like blog or newsletter piece that we would like you to kind of customize as you see fit, and then to submit it to a medical society or a health organization that you're a part of today or this week. So to give an example, so Cynthia and I are going to think about what we're going to plan to submit something to the Alameda Contra Costa County Medical Association, and our ask is that they include it in their next newsletter. So you might be part of multiple organizations that you could submit kind of a proposal that they include in an upcoming newsletter. And the reason to do this is to kind of socialize the campaign and to kind of get more visibility around it, so that we can like refer to different publications and put that on our campaign website and kind of build more public visibility for their reputational risk for continuing with business as usual. So I am going to put the template in the chat right now for everybody. And then Heather asked if the organization needs to be regional. No, wide open. So, this is a national campaign. So, yeah, if you could do it for like AMA or kind of big or small, but really we're just trying to build public awareness and especially medical kind of community awareness, health community, to have Cigna feel like there's more and more eyes on them and kind of looking for their response. So I put the template in the chat. Would anybody want to share, maybe if you could put in the chat, like who you would think about submitting a post or a newsletter piece too, and then we can kind of get some ideas too.
Could we send it to our hospital, like Cedars?
Yeah, definitely. I think any publication, like we're just trying to broaden the circles of awareness and thought about it. So yeah, the American Psychiatric Association would be awesome. Society of General Internal Medicine, super good idea. ACP, yeah, that would be really great. Somebody else said employers, public, private, pensions, make decisions. Yeah, the UC system, David, that's a good point. So does anybody know if the UC system uses Cigna as an insurance policy? I don't know the answer to that, but we're curious.
I don't think so. This is Lisa. I don't think so, but I can look into it and try to find out.
That'd be really helpful because many of us have had conversations about how the UC system, because of their own divestment, commitment, that if they do use Cigna, that would be kind of an extra, weight to if the UC system, if we could somehow get them to say like, Cigna, we're calling on you to divest, that could be really, really powerful. So Lisa, if you could check on that and let me know, that'd be really helpful.
Sure, I will let you know. And the same applies for Kaiser because so many of our employees actually have Kaiser insurance. And when we get to that, I guess we can address that as well.
Totally, yeah. Some of kind of in our conversations we thought because Kaiser is the least has the least amount of investments, it's like 860,000 or something in fossil fuels, that maybe it won't be as big of a push to get them to commit, maybe. And we just celebrated our carbon neutrality kind of announcement last month. So again, there's like a lot of kind of alignment messaging opportunity that we could exploit for good.
Can you say that you're carbon neutral if you're still investing in fossil fuels?
That's a very good point. And yes, because it's scope 3 emissions is your kind of supply chain, and I guess investments would be in supply chain. Somebody else might be able to add to that. But so Kaiser we are not carbon neutral for all 3 scopes, only for scope 1 and 2 and some of 3, which is important because those are, kind of the electricity powering our hospitals and then kind of our internal operations. We have bought carbon offsets and we've kind of done a lot of work to make those carbon neutral, but our supply chain is not carbon neutral, and that's important because something around the order of 75% of an institution's climate footprint is scope 3. So the majority have not been assessed and have not been, zeroed out, you could say. So very powerful stuff. Rich Godfrey, make Kaiser a poster child. Yes.
Stop greenwashing.
Yeah, I mean, there's important work that has been done for sure, and there's so much more important work to do. Rich, are you in? Who's that?
That's me. Go ahead.
Are you involved in the fossil-free California fossil-free efforts for CalSTRS and PERS?
Right, I am, and I was hoping to just bring that up in the smaller group, but I hope that's probably going to come up in 6 to 7 months from now in the next board meeting. But apparently, much to our surprise, they literally invested in coal again, which was kind of a shocker. But I think they can be leveraged if multiple groups came in, including this group and California Fossil Free, and I'm working with a national church group that's very powerful in this. I think we could, with leveraged pressure, maybe have more impact.
Yeah, absolutely. So I know and love Sandy Emerson. Would you mind, Rich, sending this post to Sandy Emerson or whoever you know at Fossil Free California and asking if they could put our announcement on their website?
For sure.
Okay, that'd be really helpful. I think it's all about like cross connecting and just kind of amplifying in with our allies and our own, hopefully our medical organizations are allies too. But just the more visibility we can build for pressure, the better. Megan, you had a question or comment?
Yes, I also work with Fossil Free California, the Solar Rights Alliance, and I've been working with PERS, the campaign for PERS to divest, which is a retirement system I'm actually have a little share in. And we have, done some campaigns, especially with some of the younger folks from Sunrise, trying to get them to divest from fossil fuels. But obviously we haven't convinced them yet. Work to be done.
Yeah, if you could share this post with them to kind of, help them know that we're working on it too, and just we're really just trying to build the coalition of amplifying the same message from multiple directions. So we'll take a couple more questions, and then I'll pull the break room back in, God willing. Did anybody else have their hand raised?
Yeah. How about Jennifer?
Hi, thank you. So I actually I'm here on my own sort of volition, but I work for one of the health companies that was listed, one of the health insurance companies. So I guess my question is, I've only been there about a year. I work as a nurse case manager, but I'm a environmental public health student as well. But I don't know what my should I work like?
Oh.
There you go. But working there, I mean, would it be wise or prudent of me to kind of go to someone about this as an employee of the company?
Yeah, I think that is a very powerful potential. And if you could email me, and Mary and I are kind of starting a list of kind of connections that we have, whether institutional investors or individuals. So Jennifer, if you can email me at that email I just put in, we can kind of brainstorm about how to take advantage of that. Okay. Cool. And then one more comment, and I'll pull people back in. Good. Okay. So I'm going to try this out. Cool. So they'll be joining us back. So yeah, and then as people, hopefully, in the next couple weeks, if you can submit this post or kind of template to the newsletters, and then when they get published, please definitely email us either at the California, CA Climate Health Now at gmail.com is our kind of organizational email. But if you can let us know when things get published, that would be super helpful, and we can kind of compile them and kind of magnify them on social media and all the rest. And the email, when things do get published, you can send it to me at kp.org or California CA Climate Health Now at gmail.com.
Ashley, it's Marty. Since I'm BFF with Nam Farley at 350, because we got the safe voting thing on their site, do you think they would be a person that we would want to publish in?
Yes, definitely. And they're part of you said 350.org?
350 Bay Area.
Yeah, definitely. The 350 National is part of the kind of coalition endorsers. So yes, we would love to have it amplified there too. Okay.
And I'll run it by 1,000 grandmothers and the School of Nursing and Public Health at USF.
Yeah.
We'll see what happens.
That would be great. Marjane, I wasn't going, we could do an email easily, but you can also just click on we'll send out a summary with the link to the template for submitting to newsletters. So we're all back. We have just 5 minutes. So we're going to wrap it up. Any comments from those who broke out?
I'm going to say something because what came up was, the Permanente physicians, first of all, we have all Permanente physicians have secondary insurance through Cigna. And maybe we should be, as Permanente physicians, we should be putting pressure on Permanente to look at that. And I don't think it's through Kaiser. I think it's actually through the medical group that determines how we get that secondary insurance, but I'm not quite sure of that. So maybe we'd get more bang for our buck if we put pressure on our medical group to, put pressure on Cigna and to put pressure on ourselves, because I know my retirement, the stuff that's in the Permanente plans are all invested in fossil fuel. I can tell you that. I've looked into it.
Yeah, that's a different and a very important issue. And I think your point is very well taken. So one of the ways that we would like to propose kind of continuing this is the beginning of a conversation, is through, so I think everybody is on Slack, which is kind of our internal communication tool. And if you're not on Slack, if you could put your name in the chat right now, and then Karina or Cynthia, if you can kind of keep track of who needs onboarding onto Slack, that'd be great. So for those of you who are on Slack, we have a channel, which I highlighted here. So we have a divestment channel, and that's where posts like the press that we got about the our own press release, that's where that will get posted, and then also the brainstorming about what Bonnie's talking about of kind of how to leverage the Cigna secondary for TPMG physicians. So that's where we'll continue to communicate. So please, put your name in the chat if you need to be onboarded onto Slack, and then that's where we'll do most of our ongoing communication and brainstorming. And then, so Cynthia is going to talk now and really kind of round us out in terms of Georgia and what we can do to help turn Georgia all blue. Over to you, Cynthia.
Okay, thank you. This will be quick because we're aiming to wind up at 1:30. So we know we had really good outcomes from the election, which means we just barely saved ourselves by the skin of our teeth with Biden and Harris. But the Senate is an issue, and important people. Could you go back one slide, Ashley? Yeah, this was an article in the New York Times that Karina pointed out for us, saying that the most significant difference in terms of whether we'll get action on climate change is whether Georgia elects 2 senators in their runoffs. If Democrats win 50 seats in the Senate, large-scale climate legislation is possible. If they don't, it's simply not going to happen. So everything is hanging on Georgia right now. Next slide, please. So how can we help? 2 things. 1 is donate. 2 is actually work on get out the vote. So for donations, and don't worry about copying these down, they'll all be in the summary, but 2 interesting things. Some people are saying that Ossoff and Warnock and Fair Fight Georgia are going to have plenty of money, but that what we need to do is work on bringing in new voters. A couple interesting options are this block power, which pays block level voting ambassadors to go and talk with their neighbors. And that's said to be a very good group. They're having a fundraiser that you can join on this Zoom link, or you can go directly to donate. There's also the Voter Participation Center, which targets youth and people of color. Again, this would bring in new voters, and then you can support Warnock and Ossoff's campaigns directly. Next slide, please. How to help get out the vote. Another interesting option you may not know about is this group called Working America, which works with working people, labor, and they persuade by talking to voters about issues. It's a little different than a lot of the Flip the West that's just talking to Democrats, people who are already registered. So this would be interesting. And then you can volunteer with the Warnock campaign, with the Ossoff campaign, with Fair Fight Action, or with Flip the West that many of us are familiar with. So I'd encourage everyone to sign up to do something. This is so critical. And we're not going to get the climate action we need. We'll be able to hold the fort, do a little better. But for the big big action we need, I'd encourage people to do this. And we'll put all this in the summary that comes out in the next couple days.
Yeah, but actually, I mean, I'm noticing this one's at 5 p.m. tonight.
Yeah, it's
Yeah.
today.
Oh, I
So
can,
we'll
why don't we
figure
put
it out.
that in the chat then?
Thank you,
Okay.
because I can send it out to my group on my end.
Okay.
Okay.
I will put that in the chat right now.
Can you send these beautiful slides today? Because
Absolutely.
I
Thank you for
don't,
asking.
yeah, because then all the links are right here, and
Yeah.
then we don't have to remember all of the chat stuff.
You bet. Yes, thank you, Noemi.
Oh, okay. You want to just do that? Do I?
No, go ahead and put it in the chat too, Cynthia, because I want to send that out right away about the event.
I am trying to get that. I'm going to have to copy it. I'll go back. I can get it from another slide. It's okay. You go ahead,
Yeah.
Ashley.
Okay. So thank you all for spending your hour with us. We are finishing out the year strong, maybe too strong. We're going to take a vacation the last half of December. But before we do, next Wednesday, 12 to 1:30, there's going to be a really, really awesome media training for us, for climate health professionals. And that could not be more important because, you know, the next thing, which we don't always know when it's coming, we need each other to be skilled up to speaking to journalists and reporters in ways that really deliver the message as clearly and crystal, you know, powerfully as possible. And so this media training is really planning for the next mobilization that we don't know when it'll be. So that's really valuable. There's a ton of effort going into making it awesome. So there's a place here to register through Eventbrite, and this will also be shared out. And then in a couple of weeks, Wednesday, December 9th, from 12 to 1, there's going to be a webinar in a big coalition also about the health benefits of electrification. And we haven't sent invites for that yet, but just kind of keep that on your radar. And importantly, we're kind of in conversation with some of our environmental justice community partners in terms of the justice impacts of electrification so that nobody is left behind or displaced, which couldn't be more important. And then lastly, our December Climate Health Now meeting is hidden from me. It's December 16th, and that'll be back to the Wednesday, and that'll be kind of the last event for the year. So we did it. I think that's it. We have time for just a couple questions, and then we for sure will share out all this like really important, timely information, and really appreciate everybody's time. So yeah, if there's a couple questions, we can talk about those.
Ashley, I'm not a Kaiser physician, but I do have Kaiser privileges, and there may be other doctors that have privilege at Kaiser as consultant. I don't know if you want to kind of use more people in your group that wants to work on Kaiser. I think it would be powerful if Kaiser actually drops Cigna or threatens to drop Cigna. Because you have a lot of physicians in leadership positions, I think it's a more friendly kind of organization to approach.
Yeah, I agree. Definitely. And I think the way to continue that conversation would be to make sure that everybody's on the Slack channel of the divestment channel of Slack, because that's where we'll kind of continue. And, you know, we'll keep sharing communications, but I think, you know, I definitely think everybody's kind of on the right track of trying to focus on how to leverage our tools best, and the Kaiser individual and institutional policyholder leverage point, I think, is something that we will make good use of. Yeah. Thank you, Yoshi, for joining. And Yoshi needs to be onboarded to Slack. So I will, Yoshi, can you put your email in the chat right now, and then we'll be sure to get you linked in? I don't think I have it. Any other comments?
Phone number, Yoshi, please.
I just have one quick comment. You know, I see Kaiser as kind of low-hanging fruit versus something like Cigna, honestly, because it's local and it's less invested. And we also, many of us are already tied in with them. So that might be a more successful kind of first attempt, but that's my opinion. Thank you though. But thank you so much for this work you're doing, Ashley. It's so important, and everybody else, Cynthia, Mary, everyone else involved. So appreciate,
team effort, for sure. Also, I forgot to mention, if you're interested in being a co-lead with me on the divestment part of our work, we're hiring for pro bono. So if this fires you up and you want to join me in partnership, kind of, a subgroup lead, let me know. And
well,
I put the link.
I would do, some work, and I could certainly help out with some of the Permanente stuff too.
Okay. Yeah, awesome. I'll take you up on that. And I put the link just now to the amazing tearjerker for sure video that that Cynthia introduced me to by our youth poet laureate. I put it in the chat right now, so that's worth a watch. Maybe one more comment or question.
It's not a tearjerker in terms of making you feel bad. It's tears of joy and beauty. So it's really a wonderful thing to see as we ground ourselves in what we're working for moving forward.
Yeah, that's well said. Cool.
Ashley, can I just want to thank you for doing a really, really great job with this, and I hope to contribute more, particularly on the Kaiser side. Thank you so much.
Yeah, my pleasure. My pleasure. Who was that? I couldn't see when you were speaking.
I'm sorry, Rich Godfrey.
Oh, great. Okay, cool. Thank you. My pleasure. Glad you guys show up to make it feel like it matters.
I have a quick question.
You.
I have a quick question. Can our non-physician partners use those links to help flip Georgia, or are those okay?
Those are not for physicians. That's for anyone.
Anyone.
Okay.
Yeah. Anyone
and
who cares.
Do you have? Because I feel like the point of, well, I'm a doctor and this is really scary for health is a strong message for people. Do you have suggested scripts for a partner?
They will come up with scripts. All of these.
They will come up with scripts. They will give you a script. Sweet. Okay, cool. Thank you so much.
Yeah. Great. Okay. Thanks for joining. Okay. Good to see you all.
Right.
We'll be in touch.
Thank you, Ashley.
Bye. My pleasure. Bye.
Bye-bye.
Stay well. Get your flu shots if you haven't already.
Done.